Lung cancer and mesothelioma are two aggressive types of cancer that can be difficult to treat. However, advancements in medical research have led to the development of several treatment approaches that may help control these diseases or prolong patient survival. Here are some of the major treatment options available. Surgery. For some patients with early-stage lung cancer or localized mesothelioma, surgery may be performed to remove part or all of the affected lung or lining of the lung. The type of surgery will depend on the size and location of the tumor. Common procedures for lung cancer include wedge resection, removal of a small tumor, lobectomy, removal of an entire lung lobe, bilobectomy, removal of 2 lobes, and pneumonectomy, removal of an entire lung. Pleurectomy, decortication involves removing the outer lining of the lung and scar tissue. For mesothelioma, extrapleural pneumonectomy is sometimes used to remove the lung, lining of the lung and diaphragm. Surgery aims to eliminate as much of the cancer as possible. However, not all tumors are resectable due to size or spread. Chemotherapy. Chemotherapy uses anti-cancer drugs to destroy cancer cells. For lung cancer, chemotherapy may be given before or after surgery to try to kill any remaining cancer cells. It can also be an important treatment option for individuals with advanced or metastatic disease that has spread beyond the lung area. Platinum-based doublets are a standard first-line treatment. Common chemo drugs include cisplatin, carboplatin, paclitaxel, docetaxel, pemetrexed, gemcitabine and vinorelbine. For mesothelioma, a pemetrexed-platinum combination is frequently used. Chemotherapy is usually given through and for over several weeks or months and aims to shrink tumors and slow cancer growth and spread. Side effects may include nausea, vomiting, fatigue, hair loss and increased risks of infection and bleeding. Radiation therapy. Radiation therapy uses high-energy X-rays or other particles to destroy cancer cells by damaging their DNA. It may be used in combination with surgery and chemotherapy to more effectively treat lung cancer. For non-small cell lung cancer, NSCLC, radiation is often given after surgery to kill any remaining cancer cells. For small cell lung cancer, SCLC, radiation is typically part of initial treatment along with chemotherapy. It is sometimes used for mesothelioma as well, either after surgery or on its own for advanced cases. Radiation treatments are precisely targeted at the affected lung or chest area and typically provided daily as an outpatient over several weeks. Side effects can include fatigue, skin irritation in treated areas and increased risks of infection. Targeted therapy. Targeted therapy uses drugs to specifically attack vulnerabilities within cancer cells. Several targeted agents have been approved for NSCLC, especially when a tumor exhibits specific mutations. Common examples include EGFR inhibitors like gefitinib, Iressa, and erlotinib, tarsva, for lung cancer with EGFR mutations, ALK inhibitors like crizotinib, Xalkori, for ALK rearrangements, and immune checkpoints inhibitors like nivolumab, Opdivo, and pembrolizumab, Keytruda, for a variety of lung cancers. Targeted drugs aim to block the growth and spread of cancer at a cellular level with more precision than traditional chemotherapy and often have improved tolerability. However, they typically only benefit cancers driven by specific genetic abnormalities. Immunotherapy. Immunotherapy is another type of systemic therapy that stimulates the body's own immune system to fight cancer. Checkpoint inhibitors are a form of immunotherapy approved for lung cancer and mesothelioma. They help counter cancer's ability to avoid immune destruction by blocking checkpoint proteins like PD-1, PD-L1 and CTLA-4. Examples for lung cancer include nivolumab, pembrolizumab and tislelizumab. Cemiplimab has shown promise for mesothelioma. Immunotherapy can sometimes produce long-term survival benefits by inducing an effective anti-tumor response. However, immune-related side effects can occur due to overstimulation of the immune system against healthy cells as well. Immunotherapy may be used alone or in conjunction with other therapies such as chemotherapy and radiation. Other treatment approaches: in some cases of advanced lung cancer and mesothelioma, local therapies like high-dose radiation may be delivered directly to the chest through brachytherapy using temporary or permanent seeds, or with stereotactic body radiation therapy (SBRT). Photodynamic therapy uses light-activated drugs to destroy cancer cells and has potential niche applications. Hyperthermic intraperitoneal chemotherapy (HIPEC) delivers very high doses of heated chemotherapy into the abdomen or chest to target small amounts of remaining cancer cells after surgery. Clinical trials evaluate new drugs and combinations as well as non-mainstream treatments such as gene and virus therapies which show early promise but require more research. Palliative care aims to relieve symptoms for patients when cancer cannot be cured. Making the best choice among these options depends on various disease and patient factors. A multidisciplinary team approach with specialists is often needed to devise an individualized treatment plan for lung cancer or mesothelioma. While a cure is not always possible, integrated therapies have significantly improved survival outcomes and quality of life for many patients. Current clinical research focuses on diagnosing these cancers earlier, increasing personalized precision medicine and developing even more targeted and less toxic next-generation therapeutics. As medical science continues to advance our understanding of lung cancer and mesothelioma at the molecular level, more and more options are being developed to combat these deadly diseases.